Hey there, Dr. Andrews, board certified plastic surgeon here in Coralville, Iowa, here to talk to you today about breast augmentation, a very popular procedure. It is one of the most common procedures that we perform as plastic surgeons. Here at Dr. Andrews Plastic Surgery, there are 4 things that we like to talk about when we talk about breast augmentation. Number 1 is the type of implant that we used. There are a number of implants. They come in different shapes, different sizes, of course, but the key is what the implant is filled with. And the implant manufacturers characterize implants based on their fill. So a silicone implant is an implant that has a silicone shell filled with silicone gel. A saline implant is an implant that has a silicone shell but is filled with saline. The key distinctions between the two is the silicone implants can feel more natural. Some say they can look more natural in a patient. They are associated with less rippling. Of course, all implants come in different sizes. One of the nice things about a saline implant is that it has a fill range. So if you have a 350 cc saline implant in the patient, you can actually underfill it by about 10 cc's or overfill it by about 10 cc's. And so there is a little bit more flexibility with a saline implant. But silicone implants are really the most popular implants that we have right now. And we have an implant called the highly cohesive silicone gel implant, the so-called gummy bear implant, that has even less rippling. There's a lower capsular contracture rate associated with those implants. And so really, in terms of technology, the silicone implants are the most technologically advanced implants that we have now. The next thing we like to talk about is whether we put the implant above the muscle or below the muscle. And so we have the pectoralis muscle, and the implant can be placed either above that or below that. And there are different pluses and minuses with respect to that. Typically, women who come in for breast augmentation don't have a ton of breast tissue, and so the more camouflage, the more soft tissue we have to place on top of the implant, the more natural a result a woman can have, meaning, like I mentioned before, implants can ripple. Both saline and silicone implants can ripple. And if we place them below the muscle, there's a little bit more soft tissue on top of the implant to help camouflage some of those imperfections that we might see in the implant. Some also say that implants age better in women where they are placed below the muscle. The muscle kind of helps to constrain the implant, and there's less of sort of a water hammer effect on the woman's breast over time. Compared to when we place them above the muscle, we see that stretching of the breast can be more dramatic when the implants are placed above the muscle. There's also something called capsular contracture, and capsular contracture is where a woman forms really intense scar around an implant, and studies have shown that when the implants are placed below the muscle, there's a lower rate of the development of that capsular contracture. And capsular contracture can really be distressing for patients because it can make the breast hard, can make it look unnatural, and can also be associated with some pain. So it's something that we want to try to avoid if we can. The other thing we talk about with respect to implants and implant placement is where we make the incision. The incision can be made in the fold. It can be made around the areola or at the inferior part of the areola, or it can be placed in the armpit. Most of the studies now are showing that when we place the incision in the inframammary fold, the patients do best long term. One of the key things that we have learned about placing the implant through what's called a periareolar incision is that the incidence of that capsular contracture that we mentioned previously, the incidence of that complication is a little bit higher. The other thing that we're really trying to do nowadays is avoid any potential contamination of the implant when it's placed, and we are so vigilant about that. we are actually putting what we call a nipple shield. So we're putting a little piece of Tegaderm or a betadine soaked sponge on top of the nipple and areola to help protect the implant from any bacteria that could contaminate the implant from the nipple and the areola. So most plastic surgeons like the inframammary incision. The armpit incision is a good incision. It's a good incision, especially when we use saline implants. But the incision can be conspicuous when a woman wears, a tank top or something, that shows the armpit. And so many plastic surgeons are avoiding that. But there are some plastic surgeons who like using that incision and can do a really, really good job and have a very natural look. But most plastic surgeons, as I said, like the inframammary incision at this point. The last thing we talk about is size. And size with respect to breast augmentation is a very personal thing. There is something called biodimensional planning where you actually use a woman's current base width to determine what type of implant, what size implant is placed. Because one of the things that we know, if we respect a woman's base width, meaning put an implant in that is as wide as or narrower than her current base width, all we're doing is filling up that breast and a woman will have a natural look. If we violate that rule or that precept, meaning put an implant in that is wider than a woman's breast width, sometimes the breast can assume the shape of the implant and have a more round, augmented look is like what we like to say. We all also call that the Baywatch look. Now, some women want that look, and it is something that we discuss with our patients. Here at Dr. Andrews Plastic Surgery, we have this nice sizing system that we call the Mentor sizing system. And so essentially what it is a woman has a bra, and then we have these anatomically shaped sizers that they put in the bra, and it really can help them see what they would look like in a tight shirt or form-fitting clothing. And then we use that to do what's called a simulation. So we use a system where we take whatever size they chose with the Mentor sizing system and use that to create a simulation so that they can actually see on their body what that would look like. We can also simulate a lift if a woman needs a lift. And so it really is a powerful process that we have here in our office. Some people ask about recovery with respect to breast augmentation. It really can be a quick recovery. We're using something here at Dr. Andrews Plastic Surgery called a pectoralis block, serratus plane block, or an erector spinae block. Essentially what a block is using a long-acting local anesthetic to decrease pain. And so basically we're blocking the nerves that supply the breast, and it can really decrease narcotic use after surgery. And we can even do the procedure without the typical gas anesthetics, and the gas anesthetics can cause postoperative nausea. And so the recovery can be really quick. We can do the procedure on a Friday or a Saturday, and a woman can easily be back to work on Monday. One of the keys is even if we do allow a woman to go back early, we do not want them working out for about 4 weeks, sometimes even 6 weeks, depending on the procedure that we do, and that's to help prevent implant malposition and to allow the incisions to heal. One exciting thing that we're doing for breast augmentation is the use of fat. And so fat grafting really has grown over the last 10 years with the development of devices that allow us to process fat really quickly and really efficiently be able to produce fat that we can inject either into a bottom for a Brazilian butt lift as we term it, or for fat grafting to the breast. And we can really increase the size, usually about a half a cup size to a cup size per procedure. So it is a procedure that may require multiple treatments to really get a woman to their goals, but that is also a good option for certain patients. Sometimes we perform something called composite breast augmentation, where we put an implant in and that sort of sits down lower in the breast and put fat at the upper part of the breast to really soften the takeoff of the breast, and that can be quite a powerful procedure as well. With respect to a woman's breast shape, The last thing we like to talk about is whether a woman actually needs a lift procedure when they come into us for breast rejuvenation. And so sometimes with weight gain, weight loss, or pregnancy, lactation, a woman's breast will engorge but then deflate. And during that deflation process, a woman can have a breast that is long and doesn't have a lot of volume. A lot of people don't realize for a breast to look natural, for a breast to have good shape, it needs volume. Right? So even if a woman comes in and is not interested in necessarily having a larger breast, sometimes if they have a deflated long breast, they really need us to add some volume in addition to doing a lift to give them good shape. And we'd be happy to evaluate you, talk with you about the current shape of your breast to determine whether a lift and an augmentation or a lift and fat grafting would be a great procedure for you. One of the things that we're offering here at Dr. Andrews Plastic Surgery are Zoom consults. It's something that we were doing during the COVID pandemic, but we're also continuing to offer that procedure because it allows us to really do a quick exam, talk to patients, understand their goals, and we can actually even do a screenshot. And I've actually even done simulations for patients via Zoom. And so that's something that we're offering here as well. So thanks for tuning in and learning more about breast augmentation. We'll be happy to see you to discuss your goals, and hopefully we can help you reach the aesthetic results that you want. Thanks again for tuning in.